thank you so much for the invitation to join you. Ivan asked me to join you. It's great to also the Socialist Health Association represented in the room. I can see a number of faces of people that I've already had the pleasure to meet already. Well, I've been in Manchester for the day today, so I've visited 42nd Street earlier today, and I've just had a meeting before this one with the Asylum Collective, and I'm endeavouring in my new post to make sure that I'm getting out across the country as much as I possibly can. It was great to hear the contribution from Ivan. He's actually said many of the things that I wanted to say, but I will say a few more things in addition. I think it's very clear from his contribution that here in Manchester you've got an advocate on behalf of mental health, someone whose commitment to this issue is unparalleled, I think, and I'm really grateful to be joining Ivan here today. As you just heard, I was appointed to this new post, this new shadow cabinet position in September. I'm the new shadow cabinet minister for mental health, and I've been leading on mental health for the Labour Party since October 2013, but I'm now doing it just focusing on mental health, whereas previously I was the shadow minister for public health with responsibility for mental health. I've been in this post now for coming up for 5 months, and I have endeavoured wherever possible to join meetings like this because I'm absolutely clear that the voice of service users, of carers, the voice of survivors is absolutely vital if we as the Labour Party are going to make a difference going forward. Similar to what Ivan just said, we hear a lot about consultation. We often also hear the words co-production, but they actually really need to mean something. And it's meetings like this that are really important for us as politicians to hear firsthand from you about what you think are the issues, what the challenges are, but also where we can make a difference. And so my job is first and foremost to hold the government to account. And I'll speak very briefly in a moment about where we're at in terms of mental health nationally. It's not a pretty picture. But it's also my job to think very differently about how the Labour Party would do things come if we're working towards being elected in 2020, and I'm working with lots of different partners within the Labour Party and beyond. We're going to have a very specific policy commission. One of the 8 policy commission strands for the 2020 election is going to be on mental health. I think that's really exciting for the Labour Party. I think it's really important, and there'll be an opportunity for every single person in this room to contribute to that, to actually put forward a manifesto which addresses so many challenges that I know many of you in this room face, and think actually about how we can change the focus. Because I believe that we've got a system at the moment which is focused on crisis. And we have a mental health system which is in crisis, largely because it focuses on crisis. And also because of all the things that have happened over the course of the past 5 years, all those support services, all of what I call the glue in our communities, has largely been stripped out, and whether that's over 700 children's centres that no longer exist across our country, whether it's the youth services that we know make such a difference to young people. And I heard only this morning from 42nd Street about how, for many young people, youth services are the first port of call that they go to if they were in mental distress. Whether it's the fact that we've lost so many befriending services. We know in the past year alone we've lost 30% of educational psychologists, which really make a difference in our schools and our places of learning. We know in terms of the investment in our leisure services and our outdoor spaces, which can make such a positive difference and contribution to our mental health, that they have gone as well. And all of that makes a massive difference. And then you look at what has happened to mental health in and of itself. And as Ivan said, we have a government which speaks a really good talk when it comes to mental health. I hear it across the dispatch box. David Cameron's done it on a number of occasions just in the past few weeks. But you only have to look at the figures. Well, I don't like to talk about it in terms of numbers. If you look at the numbers in terms of what's happening in 2016, we had the suicide figures come out just the other week. Suicide's gone up again in our country. We have one person that very tragically takes their life every 4 days in our prisons. I think that's a disgrace in 2016. We know that the number of people being detained under the Mental Health Act has increased. We know that we've lost 10% of nurses working in mental health since 2010, nearly 5,000 nurses. We've lost over 1,500 beds. I mean, the list goes on and on and on in terms of numbers. But behind those numbers are people that are affected. There's people sat in this room. There's people who are caring on behalf of their family members, who know the challenges that you face in order to access a service. We know thresholds have gone up. Waiting times are increasing, and we know that there's too many people working in mental health themselves that are under such duress because of the pressure of what they're expected to deliver. It's a numbers game that they're expected now, and there was only last week a proposal put forward by people working in mental health to say, you've got to think about our mental health as well because of what's actually happening in this system. It's not a pretty picture, and that's why on Tuesday I had an urgent question in the House of Commons trying to hold the government to account for the Mental Health Task Force report which they sneaked out during recess last week. They didn't want to bring it to the House of Commons. Really, really naughty. I had to demand an urgent question of the Speaker to actually hold them to account, to say actually this additional £1 billion, which they say is going to be available by 2021, they still can't confirm that that's any sort of additional money. And actually what happens between now and 2021? All of these different things are really in a terrible state of affairs. So my job is to hold the government to account, and I do that by using real case examples of in terms of what's actually happening on the ground right across the country. And people write to me every single day, and again, I know many people in this room have shared with me your own experiences of what's happening locally, and I know you've got many challenges locally in terms of your mental health services. But I'm also endeavouring to not just think about mental health in terms of mental health services themselves. I'm clear that we don't solve the challenges of our nation's mental health from the Department of Health. And at the moment, that's the only place where they're thinking about it. But it's actually what happens in our communities, it's what happens in our places of learning, in our schools, in our colleges, in our universities. It's what we could be doing in our places of work with employers. And actually, it's what every other government department does. So just yesterday, Ivan and I were voting to challenge the government's cut to ESA. They want to cut ESA by £30 a week, and somehow that's going to incentivise someone with a mental health condition to get back into work. There's no evidence for it, and it's an absolute disgrace. And actually every government department has a responsibility to think about how their policies are going to impact on our nation's mental health, because I think this is something that we will need to work on together. So I am working with colleagues like Lucy Powell, who's one of your local MPs here, on education and thinking about what we might be doing differently in our schools. I'm working with our colleagues in the Shadow Work and Pensions team about how supported housing is absolutely crucial, and again, holding the government to account over their proposed changes to that, which will make a really serious negative difference if that goes ahead. So I'm working really hard there, working with John Healy on housing absolutely crucial. And also talking about mental distress, again, government's not in the business of talking about how they might be creating mental distress, and actually how it's all the environmental factors which impact on our nation's mental health, and be that isolation, or be that poverty, or be that the quality of our housing, loads of different issues. So I'm doing my very best, but I can't do it by myself. I'm relying on people in this room to work with me to make that difference, to ensure that come 2020 we as a party have got something really exciting to offer which shifts that paradigm and thinks about mental health very, very differently. I really hope that you will join us in contributing to that, because it will be a very open process. And just to finish, again, I'm clear that as a party we need to be the party which makes parity of esteem mean something. It was actually our colleagues in the House of Lords that wrote parity of esteem into the Health and Social Care Act. If it hadn't been for them, it wouldn't exist. The Tories and the Lib Dems kind of trumpet as well, we've got parity of esteem, therefore it's all fantastic. It's essentially just words written into a bill. And again, I think it's incumbent on us to make it a reality. That's what I'm working towards. And I hope that together we can make that difference. So thanks for inviting me. I look forward to hearing your contributions.